Hi, this is Seth Houdeshell with New Leaf Counseling, and you've seen my videos that I've posted on my YouTube page probably before. I'm here today with Stephen Andrews, who's a friend of mine and a colleague in the Austin area. He is a highly respected acupuncture and Chinese medicine practitioner. So I wanted to have him here in the office today just to get a little bit of good information out there about how acupuncture works. And I practice as a psychotherapist in a pretty holistic manner, which involves sometimes referring my clients out to other providers in town who provide different kinds of services. And so I had some questions for Stephen, and he's going to be kind enough to talk with us a little bit today. So thanks for talking with me today, Steve.
Thanks for having me.
Yeah, you're welcome. So just to start out, there was a time when I didn't really know much about acupuncture or Chinese medicine, and I've actually used it a couple times. One was following a surgery that I had for my foot, and it really helped the speeding of my foot healing much quicker than my surgeon was expecting, and I think acupuncture was a part of it. And I've used it for things like headaches as well, and that's been helpful. But can you give a little bit of explanation about your field, how acupuncture and Chinese medicine work for people who really haven't ever tried it out?
For sure. And, I'll talk a little bit from my perspective, not as a whole, because everyone does treat differently within the field of acupuncture. And even within acupuncture, there's thousands of different styles and family styles and different ways to use the points and stuff.
Okay.
But the general idea behind Chinese medicine is it is a holistic way of looking at the body. So we look at diet, we look at, other lifestyle issues and see if we can correct that, as well as doing the acupuncture. So the idea in Chinese medicine is we have this bioenergy that flows through the body called qi, and it flows through different pathways and meridians. And as long as your energy is flowing, disease can't exist. But if there's blockage along one of these pathways or meridians, then disease and illness can manifest.
Okay.
So through the different types of assessment that we do, looking at the tongue, touching the pulse, question answers, we can kind of pinpoint what organ systems and meridians are out of balance, and then we can stimulate to correct that qi flow. So a simple example would be if you're wanting to water your garden, meaning you want to nourish your garden, but someone's stepping on the water hose. It doesn't matter what you do to the faucet, you're not going to nourish that garden. So you have to remove the blockage, and all of a sudden the water can go there. So not only nourishment, but also communication. So the qi isn't just nourishment or this energy, it's also information that the cells need to communicate with each other. So if the communication is off between all the cells, they can't, the organs can't do their jobs accordingly, or they start attacking themselves and so forth. So it's mostly all about just restoring the body back to its natural state of balance. Inserting thin needles into very specific points to facilitate the energy to flow, engage the immune system to activate different pain-relieving hormones and chemicals. It's so many different ways that it works.
Yeah, the qi flow really makes sense to me, because probably 6 or 7 years ago, and I might be getting a little more into the esoteric realm than I meant to, but 6 or 7 years ago, I learned Reiki and became a Reiki practitioner. And learning about how qi works in the body, the impact on my life was immeasurable, and it was empirical. I could, completely tell that it had made a difference. It was much too great an impact and an effect that I couldn't have been making it up. There was no placebo effect, because it was too strong and too dramatic. So I certainly had experience with that myself. So you talked a little bit about the application of needles as what happens when someone goes to your office, but could you talk a little bit about the herbs or how that is used?
Well, the herbs, same thing. Is the way we look at the herbs is they have a certain function. They can target certain regions of the body, and they can cause the energy to move. So the herbs medicinally can be used to facilitate the qi flow once again, but it's usually coincides with the TCM, the Chinese medicine diagnosis, that this organ is out of balance, this energy isn't moving. So these are the needles I'm going to put to help that move, and then you can also have a companion herbal formula to help support that.
Okay.
So, and the Chinese herbs can be extremely custom to where for 4 days you take these set of herbs, and then maybe we'll still use the same 10 of herbs, but we might change the ratio. Or those herbs were good for that one moment of time, but now your body's completely different, so we need to adjust the herbs again. So it's extremely custom versus, oh, let's take St. John's wort for 6 months. You know, we really get custom and specific to the individual.
Yeah, that's cool. The body changes, and so you sort of adapt the intervention as the body changes, and you see that happening. That's cool. So I think it's important to talk a little bit about myths or misconceptions about your field. I know in my field there are lots of myths around just psychological change, and just one silly one, for example, that you often hear is people will say things like time heals all wounds, but that's not true at all. Time doesn't heal. It depends on the events over time. So if healing events happen over time, you get better. If you're depressed and you just go drink every night, you're not going to get better. And so it's not that time heals, it's that what happens over time. So that's one of those myths that people say, but it's really kind of meaningless in and of itself. But I was wondering, are there any myths or misconceptions that you run into that people might have about acupuncture?
Well, one is that so many people are afraid to come in because they're afraid it's going to hurt. So not all acupuncture has to hurt. There might be certain points and needles that can be a little bit more uncomfortable than others, but then there's also different styles of acupuncture too. So the Japanese style of acupuncture versus the Chinese traditional style of acupuncture, you know, one, they stimulate the needle to create a strong sensation. They think more sensation, more discomfort, the better the therapeutic effect. And Japanese acupuncture can be really gentle with mild stimulation, and you don't even notice. So pain, you know, of the needle is kind of can be a myth. But once again, it depends on the practitioner and their style of acupuncture they practice.
Okay. Yeah, I could see how that would be a common one that would deter people, is the idea of the needles. But yeah, I've done it, and it's really funny. I mean, I've looked at myself in the mirror before with needles coming out all over the place, and it just, you don't feel them at all, really. So, all right. What about, well, are there any other myths or misconceptions, or is that probably the primary one?
That's a big one. But the other thing is a lot of times people are like, well, there's nothing wrong, so I have no need to go in.
Oh, okay.
So it's like, I don't have an issue, so why would I even want to seek out acupuncture? And I have a really interesting story with when I was in student clinic. I was treating this young teenage girl for severe migraines and getting really good results. And her mom decided one day to come in because she brings her daughter in for acupuncture, but yet she's never had acupuncture herself. So I asked her what brings her in today. She's like, oh, I'm fine. I don't have any issues. I just bring my daughter in, so I wanted to experience it for myself.
Okay.
So within the acupuncture assessment, we asked questions and pulse and stuff. And one of the first things I noticed was, you know, things felt off. So I asked her if she gets headaches. And she's like, oh, yeah, I get headaches every day for the past 15 years.
Wow, she was just used to it.
So used to it, she didn't even know she had an issue or something that could be treated or that something can fix it. So right away, it's like people don't realize that there are things that can get better. They just get so accustomed to having it. Yeah, and I think years ago, I had asked you about that. I had wanted to come into your office one time just because I'm a freak about like optimal functioning, and I felt like I was doing great, but I just wanted to see if there was anything that was imbalanced. And, you know, you never know what you might be used to, but you could function better and feel, not even know how good you could feel. So yeah. What about some common reasons that people seek your services? We've talked about a few of them here, headaches, things like that, but what is, you know, a list of some of the common things that you help with? Pain and stress are the two most common things. Personally, I think most people understand that acupuncture can treat really well. but it goes way beyond that. Ultimately, really any ailment or disease can be treated very, very effectively with acupuncture. It's just not every acupuncturist can treat all of these diseases extremely well.
Right.
So just because you get good relief with allergies from your doctor, your acupuncturist, doesn't mean he can treat your back pain just as well.
Right.
But we can treat everything from allergies, insomnia, stress, post-traumatic stress disorder, anxiety, food allergies, digestive, IBS. Right now we're getting more and more new diseases because the doctors just keep lumping them together. Chronic fatigue, migraines. Right now, infertility and birth support, really popular right now.
Right.
So, treating infertility and
yeah, I think what you said with the diagnoses getting lumped together, IBS and fibromyalgia and stuff like that. A lot of people don't understand that those aren't really diagnoses in the sense that they're not telling you anything about causality. They're just describing a problem.
Exactly.
And so with a lot of those, Western medicine hasn't really covered the causality part of that. So I think that's something that you do real well with. Do you want to tell us maybe a particular example, just for fun, of sort of a dramatic case with a really positive outcome?
Sure. There's a lot to choose from, but I had a patient come in who saying she's tried acupuncture in the past and it hasn't helped her back pain, but she hurt her back 10 years ago and has been extremely bad back pain to the point where she was seeing a chiropractor 3 times a week for the past 3 years. She was on pain medication. She was getting steroid shots in her hip and getting an epidural once a month to manage her pain. And I've seen her in pain, and I was like, that's when I offered up my services, and it was scary to see how much pain she was in. So finally, months later, she finally came in and said, I'll give it a shot. She came in, treated her, and then I didn't hear from her for 3 months. And then out of the blue, she sent me a message like, I don't know what you did to me, but I haven't been this pain-free in over 10 years.
Wow.
And since then, she's only had 2 mild flare-ups. And now she comes to see me for other issues like food allergies and digestion and just keeping that optimal health.
Cool.
So it was really neat to see.
Yeah, that's awesome. Yeah, I've had clients and friends that have seen you, and I've heard other stories about clients that you've helped, and a lot of pretty dramatic examples of stuff that people were not getting to the root of with their regular primary care doctor or even specialist, and you were able to help them. So that's really cool. So those are my questions. Is there anything that we're missing, or did you get to say what you wanted to say?
No, that feels pretty complete.
Okay. So if you want to talk with Steven further, you can find him through me if you're one of my clients, or you can go through his website, which is morningsunacupuncture.com.
That is correct.
Okay. And what's your phone number for your office?
512-468-0899.
Okay. And I'll put your tag up on this video with your website. And Steven also gave me some $40 off coupons for his acupuncture sessions for the first session, and that's regularly $85. So if you're one of my clients and you want one of those coupons, let me know. So thanks for joining us, and I appreciate you being here.
Definitely.
All right.
My pleasure.